Well, good morning, Scott. Good morning and welcome. Welcome to breakfast. I don't normally have breakfast with this many people, so I'm thrilled that you're all here this morning. For those who I haven't met, my name's Deb Langridge, and I have the absolute privilege of directing the Consumer and Community Involvement Program team. The team here are ones with our very obvious shirts around the place. If I can just introduce our team. Ben Horgan, who's up the front, he'll be co-facilitating, asking hot questions with me this morning. Kerry Mace down the front, Maxine Pollard and Cath Stewart over the back there. So, so they're the team. They'll be peppering you in between your mouthfuls to get you to either text your questions via the mobile number or to write them down on the card, and then they will deliver them to us as well, so that we've got some good capacity this morning to be involving you as we go along. First of all, though, I'd just like to be able to give an acknowledgement of country, which is an important part for our team. We'd like to acknowledge the traditional custodians throughout Western Australia and their continuing connection to land, water and community, and also like to pay our respects to all members of Aboriginal communities and their culture, and to elders past and present. So you've met me, and if you haven't met me in person, I'd love to meet you. So there may be opportunity throughout the rest of the day for us to be able to catch up and chat. The topic of today is putting the I into research. Now, I've met lots of people who have said to me, but there's no I in research. So hopefully by the end of breakfast, you will have changed your thinking about how to spell research, and that there's an I in there somewhere, not a silent I, but what we're wanting to do is to be able to encourage you to see, if you're not already aware, or to think about other ways of what involvement looks like in amazing research. Our program, as you will have seen in front of you, we really want to encourage you to be sharing hot topics and questions. I'll be introducing our amazing panel in just a sec. We've got a big launch this morning of the first time that we've aired it, one of our new CCI program videos. So I'm really excited about sharing that with you. And then we'll get to the panel, and you guys really will be for the rest of the morning to be able to be having lots of great conversation. But keep those curly questions coming. That would be fantastic. So if I can introduce the panel. So Daniel Fatovich, for people who don't know, Professor Fatovich is a senior emergency physician and clinical researcher at Royal Perth ED, as well as being the director of research for East Metropolitan Health Service. And he has an amazing focus on patient-oriented outcomes, and considers, and he hasn't just I didn't tell him to write this, but he considers consumer and community involvement to be one of the best things to happen to research. What more do we say? Is breakfast over? No, not at all. So we look forward to hearing Daniel share more about that. Jane Pearce has a background in teaching, teacher education and educational research, and is very involved in consumer advocacy across the health sector. She's been the chair of the Emergency Department Consumer Advisory Group at Fiona Stanley, and also recently has become the chair of the Fiona Stanley Fremantle Hospital Group Consumer Advisory Council as well. So she's in there doing amazing things, and we'll have a lot to share more. So each of our panel will be able to talk a little bit more about why they're there. Peter McEvoy is a senior clinical psychologist at the Centre for Clinical Interventions, and is also a teaching and research professor of clinical psychology at Curtin Uni, and has been doing some amazing work in anxiety disorders and depression, and also is working with Department of Health on putting together, and with Ben Horgan, with conducting and pulling together the development of a mental health research strategy, the first one for WA. So looking forward, Peter, to hearing more about that. Cath, Elliot. Cath has commenced as the Deputy Director of Research at the Telethon Kids Institute in 2020. Prior to that, she was embedded and part of the furniture at CARS, the Child and Adolescent Health Service in WA, and also Professor Chair of Allied Health and Kids Rehab at Curtin University as well. And then finally, Kerry Maclaurin, another one of our amazing consumers. Kerry has a passion for ensuring consumer voice of lived experience is involved and informing and enriching health research. Her background is as a consultant and manager in social and market research. She's a member of the University of Notre Dame's Medicine Consumer Reference Group, Consumer Advisory Group of the Centre for Molecular Medicine and Innovative Therapeutics at Murdoch, and has recently joined the Myositis Consumer Research Panel. And Kerry's also worked, yes, she's proud of, not that she's not proud of the other things, but yes, it's good to brag. And in 2020, Kerry worked with us with the CCI program, and specifically, some of the work she was doing was around COVID-19 pandemic. So that word that yesterday was not allowed to be mentioned, but we are mentioning it today and much more tomorrow in terms of COVID-19. So that's just a very, very brief introduction to our panel. You'll find out a whole lot more as to why they're there as we go on this morning. And I'm keen, as I said, for discussions to be, not to be ordered and death by presentation, to be great conversations as we go along. You will see on your tables that there's a folder about the CCI program. I'm absolutely honest in saying that I know everybody knows that about the CCI program, Consumer and Community Involvement Program, but we do use the acronym, as you know everybody does in the room, in terms of CCI. Who are we? The CCI program, and Gary introduced this yesterday if you were here for day one. We're a platform of the WA Health Translation Network. And also a member of the COVID-19 research collaboration. I suppose our program supports consumers, community members and researchers to work in partnership to make decisions about health research priorities, policy and practice. Our mission and our vision is about improving lives by ensuring the community's voice is heard and understood in health research. And we turn up to work every day to be able to enable involvement in health research by supporting and connecting community, as we're doing today, with researchers, partners and policymakers. So, you'll find much more information about who we are if you haven't worked with us before in those folders, and we'd absolutely love to talk to you moving forward as well. That would be fantastic. So. Just a really quick blurb, really, but what I would love to do is just to set off the session this morning is to launch our last in our video series. So it's the fourth in our video series on consumer and community involvement. And just to give thanks to Torbjørn Faulkner, Darren Gibson and Professor Fiona Wood. Fiona was meant to be here on the panel this morning, but was called to the East Coast for urgent family business, of which, has been happening a little bit in the last little while with members of our team. So, so you won't be able to get an autograph from her this morning, but I hope you enjoy this. It's a remit about driving consumer and community involvement in organisations. So why is it important? And to be used to be able to share that with executive and decision makers. Thanks, Scott.
I think CCI is so important in research because we have ideas, are very, really passionate about the ideas that we could do X, Y, or Z. And I've been very focused all my career on translation, understanding that everything has to mean something to the patient, because we have to make sure that what we're doing will make a difference to somebody, sometime, somewhere.
If it's done properly, so you involve consumers right at the outset of the research, then the output of the research is much easier translated into communities and consumer groups because they've asked for it. And then the research outputs will have meaning to them. So it's not people like me, the researchers, driving it. It's actually them asking for the results that we can provide as a research community.
Having CCI involvement at the start of the project and throughout really changes that focus away from evidence purely an evidence-based approach to a consumer-driven approach. And this really sort of enhances the overall outcome of the project.
We live in a time where we have got to be very aware of our resources, and so we have to focus those resources really carefully around our research and our clinical care. And so to bring the voice of the consumer into that research paradigm is fundamental.
I think CCI is applicable to all kinds of research. If the research question is not relevant, it's not a problem. So it's applicable to any kind of research. And again, where you do the research is just tools, nothing else.
I say to all my colleagues within research and in government, the Consumer and Community Involvement Programme is essential to enrich on the development of any policy, strategy, programme that you want to develop. So I'd highly encourage everyone to get involved within the CCI programme.
So working with the CCI program team has been really insightful. I think we have an increasing understanding of the need to engage our consumers as clinicians, and to be able to do it in a structured format it just makes it easier.
Makes me smile when I see that a young kid with cerebral palsy could actually run the City to Surf, and it was all based on parents asking for that particular thing. We did research around it and we developed a method for it to happen, and he did it, you know. That makes me smile.
Research is vast, and so you have to have that voice of the consumer, I think, in whatever research field you're in.
Thank you. I would clap as well. As I said, that's the fourth in a series of videos that you can find on our website, but they all give a bit of a different perspective. So one from consumers that we've worked with, another with researchers that we've worked with, and then a more general one about CCI and the CCI program. So please visit the website and keep sharing and using those videos. That would be fantastic. Okay, so again, write your questions down. There are cards on your table with pens and or text to me. But what we're going to do, so I'll leave that up as we go, is I'd love for you guys, the panel, to all introduce yourselves basically. And as I did say, I do like to keep to time, and we're kind of going okay. So 5 minutes, basically. Hot seat, 5 minutes. Daniel, if we can start with you. Why are you here? And what have you done in terms of consumer and community involvement in research?
Thanks, Deb. So I like to do things a bit differently, so I'm going to start with the end rather than the beginning.
Fantastic.
So I've always thought that research is really important, and that my vision is that every patient who makes contact with a health service has the opportunity to participate in some form of useful clinical research. And then my mind was expanded when I realised that, in fact, if every time a patient interacted or made contact with a health professional, they said something like, "What kind of research can I get involved with for my condition?" that would really push the whole health professionals to actually really think about research and doing research. So it actually needs to be a two-way street, not just driven by health professionals, but consumers can really support that. And so an organisation like CCI that's community-based and grassroots, if they could kind of spread that message for me, that would really drive the research community and the research outputs forwards in somewhere like WA and Australia. So that's the point that I've come to. But sort of my involvement with CCI has included things like community conversations. We did one on concussion with Lindy Fitzgerald, where I was not only a researcher but also a participant, and seeing that process was very useful. And then as a result of that, our research group did a sepsis community conversation, and that was really, really helpful and value added. And then, over time, you form relationships with various people in CCI, and sort of the most useful thing, I suppose, was last year I was the ministerial advisor for the passage of the new Amendment Act for Medical Research, and they really wanted like a community a consumer group to say, yes, we support the Act, and like at short notice I have to get onto the phone to somebody and say, can you send me an email now saying that you support the Act? And like that's, having that trust and support is incredibly useful. So really there's quite a spectrum of activities there.
Great. Good, thank you. And I haven't paid or there's no inducement or anything. Can I just say they're free to say whatever they like as we go along. Jane, we'd love to hear your story. And
yes, hello everybody. My name's Jane, and I'm, as Deb said, I'm involved at Fiona Stanley Hospital as a consumer. Well, consumer sort of. I interject wherever I can. I suppose that's my role. I've been involved. My first involvement was with the emergency department at Fiona Stanley, and it was a new group set up very soon after the hospital opened, and we think we're unique in. Maybe in Australia even, as having a consumer group based in the emergency department looking at those local issues. And one of the great things about the group is that we've got some clinicians in there. So we've got 4 senior clinicians, including the head of department. The group was set up by a senior consultant, and we've got 6 consumers in that group. And we've really grown from being a group of people that met every couple of months to a real kind of, well, part of the family. You know, they see themselves as a family there, which I think is wonderful. So I think we're now part of that family, and we're now being approached by nurses, by clinicians to sort of say, oh, can you help out with this? Or we want some education happening here. And we also are now working with nurses as well. So it's become a very collaborative group. And from that experience, I suppose my sense of the possibilities for consumer engagement just sort of, grew huge. I really have the sense now that it's possible for consumers to be autonomous and to drive processes, to be proactive rather than reactive. And I think a lot of consumer groups are still quite reactive, and that's what I think we need to change. And I'll get onto the research components in a minute, but something I'm really interested in is the way in which clinicians and consumers communicate. I was an English teacher once, and once an English teacher. I'm very interested in an approach to communication with patients called Teach Back. I don't know if you've heard of it, you may well have done. The idea is that clinicians, when they're talking to patients, won't say, do you understand what I've just told you? Because everybody was going, oh yes. Instead, the clinician says, now I want to make sure I've been clear in what I've said. Can you explain to me what you think I've said, what you understand by what I've said, or what you're going to tell your family when you get home? And so I've been pushing that and thinking about that, and it occurred to me, and it kind of picks up what Daniel said. How wonderful would it be if instead of clinicians saying to consumers, can you tell me? If consumers could say to clinicians, can I just make sure you understand what I've said to you? So I've come to you with these ideas, I've come to you with these issues. What do you take from that? What do you understand from that? So to really kind of, change, it's about power relations, I think, largely. I think, consumer engagement is about taking power. So that's really where I am with respect to research. I think consumers ought to be able to say, we need to know about this. We want you to help us about, understand this, make things better for us. And one of the other things I'm really interested in is how consumers can actually be part of a research process at all points. So at the beginning, when you sort of begin to think about what your process is going to be, what your topic is, giving advice on grant applications. I've been involved in that. Giving advice on research papers. I've been involved in that. Giving advice about how you ask questions, who you talk to, how you maybe engage people who you wouldn't necessarily find have an interest in research, and it's that talking back. So my vision, if you like, would be to have consumers in the middle of the research process, right the way from the start, and have that kind of equal, kind of proper conversation about what should be researched, how you should do it, who's the research for, why is it important. So thanks,
Great.
Deb.
Thanks, Jane. Fantastic. Peter.
Daniel started at the end, and I'm going to start at the very beginning.
I love this already. What a panel. What a panel. Fantastic.
So my first experience with consumer involvement in service design was in my first job at St Vincent's Hospital in Sydney. I was a junior clinical psychologist there and was delegated to attend a meeting with executives. And this is, I don't know, almost 20 years ago. They may have been quite ahead of their time. Consumers were involved at the highest level of decision making. And I attended this meeting feeling like the most junior person in the room, very unsure of myself. And I think I made a contribution to the discussion. I may have put my foot in my mouth. I have no idea what I said. But the thing that I remember is the consumer in the group really coming down on me like a ton of bricks. So really quite hostile in the meeting, and I just had no idea where this came from. Later on, I obviously debriefed with various people in the meeting, and they said, no, you didn't actually say anything too wrong. So this was my introduction to consumer involvement. So I said, well, if that's what consumer involvement is, I'm not interested, right? So for the next decade or so in my clinical work, I loved working with my clients or the patients and taking a very collaborative approach to the treatment that we were embarking on. And regularly monitoring outcomes, ensuring that I was having an impact on the individual level, or if I was working with groups at the group level, and then making sure that the outcomes were benchmarked to international benchmarks and exceeding those benchmarks, and if not, finding out why and improving it. But in terms of consumer involvement in service design or research, that formative experience really had quite a big impact on me. I've since done a 360 turn, obviously. Experiences like those with Ben that I've had in the last couple of years have just been outstanding, and actually some of the most rewarding experiences of my whole career. We're working together on, as you mentioned in the introduction, developing a mental health research strategy for Western Australia for the first time. Yep. And this project was co-designed from its inception. So from the very beginning, the Delphi study, which we're using to identify those priorities, was Ben's idea initially. And we've been working together to bring that to fruition. A second part of that project is understanding research capacity and culture and barriers and enablers for getting more mental health clinicians involved in research to meet as many of those priorities we identify as possible. And another aim of that part of the project was to identify barriers and enablers of people with lived experience getting more involved in research. So we looked for a tool to measure this and to understand the factors in Western Australia that are at play, and there isn't one. So there's a very well-established, validated tool to assess research capacity and culture in health workers, but there isn't one that we've been able to find for people with lived experience. So we decided to add that to our project. So we're currently in the process of developing a tool that will help us understand what would help more people with lived experience get involved in research. So in the last 4 or 5 months with this project, we've consulted with hundreds of people with professional but also with lived experience, and it's just been hugely rewarding, I think, and I've certainly learnt a lot about language, talk about language. Every reference group has its preferred language, so that's really important to respect. And then, of course, there are differences of opinion as well, even with the same group. And consumers have their preferred language, and I think I've got a minute left, one of the really interesting things for me personally, I guess, and professionally, is sitting with some of those challenges in terms of challenging my way of thinking and my training and seeing it from those different perspectives. So the question, so what have you heard from today's session that would be helpful for you moving forward? The idea of flipping that on its head and actually you ask me what I've understood of you, I think is a fantastic idea, and hopefully, I hope that I start the conversation that way, first reflecting what I've heard before jumping in with a solution. And I guess the last thing I'll say is moving forward, the Enable Institute at Curtin, which is just launching Domain Lead of Mental Health for that. And it is all about consumer-driven research. It starts there. and then moves forward from that point.
Watch
So
this
that's
space.
really exciting.
Yeah, no, that would be
yeah,
great.
exciting.
And Peter, you don't look. You look. I think what you looked like, a while ago. So nothing's fallen off in terms of engaging with consumers at all. So that's good.
I'm still here.
Absolutely.
Yeah.
So that's always.
Survived.
It's good for everybody to know that it actually is for good. Yeah, not for anything else. Cath.
Yeah, thank you so much for having me here today. It's
pleasure.
wonderful to see everyone and an incredible panel. I think I'd just like to touch on a few things that have been spoken about. Really, consumers being our greatest teachers. I think that's something that we have learnt over the last 10 years particularly. So I'm lucky enough to be part of a team that works across kids rehab, which is part of the Department of Paediatrics at the Children's Hospital, as well as Curtin University. And 10 years ago, we set up a consumer group with a lot of support from many people to get that started. And the things that we worked with initially were things like reviewing lay summaries, reviewing journals before they went out, being parts of grants. And then we actually started to talk to our consumers, and they started to take the lead on what they should be doing and how they felt the consumer group should be run and the real level of involvement that they wanted to have. So we started to look at, them being involved at the very beginning. So the priority setting, what research should we actually be doing? What is important for, children and families with cerebral palsy? So over the last 10 years, we've learnt so much from the children and families that we work with, as well as from our clinical teams. So it's been a real journey, and we started with small baby steps, and we're still getting there. And one thing I think a lot about is it would be lovely to be able to really evaluate the huge impact that our consumers have had on our research, making sure that the research is immediately translatable for children and their families, and also making sure that we're researching the most important things. So, the next step is really actually being able to capture that value add to the research.
Yep. Great.
Thank you.
Thank you. And Kerry, last but definitely not least.
Yeah, thanks, Deb. And yes, it's an honour to be sitting up here with such great people and hearing all these fabulous things about consumer and community involvement. And I actually came yesterday as well to listen. So I also want to say thank you to all of you for the research that you're doing, because for me, this is such hope. So I sit here with my T-shirt, and I don't know how many of you who would have researchers or clinicians who wear their T-shirt to advertise your research, but that's where consumers come in. So,
blatant. That's exactly right. Blatant
and May is Myositis Awareness Month. So, but actually, I had a similar experience to Peter with my first involvement in CCI. So it was in 2015, and I had a friend who rang me up. So I'm a parent of a child who had very interesting health issues when she was young, including pyoderma gangrenosum, which for those of you who don't know, it's a skin condition, and it's extremely painful, and she had ulcers. So I got invited to this community conversation about leg ulcer treatment. And my background is research, so I'd had decades of experience of qualitative research, facilitating groups, and the organisation at the time was CCIProgram, so it was a health research network. So I went along expecting I was being involved in research. I had no idea what involvement was. And so I came out of that going, oh, well, that was a waste of time, and I won't do that again. So that was 2015, but as part of the process, I had signed up onto the membership database, what is now the CCI program. So that meant I started to get newsletters, and occasionally I'd have a look at them about new involvement opportunities. I saw that there was training as well, and it was sort of there in the background. But 2015 was also significant for me because I was trying to find a diagnosis. So I was falling over, had severe fatigue, couldn't swallow. And initially, actually it took quite a few years before my GP took me seriously, that it wasn't just age and overweight, and I needed to get fit. And it was suggested I might have MS, or motor neuron disease. And of course, being a researcher, I immediately started searching for what can I do about this. And I came across a doctor at Iowa University Hospital, Dr. Terry Walls, and she had a protocol for MS that involved lifestyle change, but she was also doing research in it. She'd done interventionary research, and she talks about the fact she was very fortunate that her boss at the hospital, looking at the research, said, well, hang on a minute, let's start lifestyle clinics. Let's start teaching our patients what you've learned. And she headed up a traumatic brain injury clinic. So they started doing all this intervention. And then through doing this, they learnt, well, actually, people don't even know how to cook. And people, can't afford to go and buy organic vegetables. So this was, looking back now, this was my first exposure of how consumers can be involved in translation. And she talks about the fact, if I was just publishing my articles, how many decades would it be before patients got to learn about this? So this is the other side, I guess, that I see in terms of consumer involvement, and an area that still has so much growth to come, that consumers can lend this value to your research in terms of being a voice for actually putting the information out there. And of course, I'm still a researcher, so with the CCI involvement, I look at it and go, please, can we evaluate it? Can we also evaluate it in terms of, I don't know how many of you have actually been consumers in a CCI involvement, but are you going back to them on a regular basis? Are you asking them, how is this working? Are we meeting frequently enough? What about, why are other people not being involved? Should we be compensating people in CCI like we do when they're clinical research participants, right? How is this all working? So I guess that's my research hat. I come back and go, can we evaluate? Can we change? Can we adapt? And including, the CCI program has great templates, great checklists that the coordinators use. Keep evolving them. And okay, then we get to the, the dirty words. We need dollars. How do we do it? So let's start being more strategic. So.
Great. Well, thank you, all of you, for that introduction into what I know now is going to be a bit more of a discussion about some of the key issues that you've all raised. And Ben, if I can throw to you, well, you're mic'd up, so, and you are an AFL master, so I know if I throw, you can catch. But, yeah, let's start heating up some of the seats of the panel and, and asking some questions and some discussions. I'm also getting a few questions, so as we go along, so I'll share those as we go along as well.
That's great. Thanks, Deb. And thank you all for your initial insights. You've pretty much covered all the questions I had to ask. Thanks for coming, everybody. It's been great. True. I suspected that this might have been the case. It's wonderful to see so many really successful researchers in the room. Many of you I've worked with previously, so I know that we are preaching to the converted. It's also great to see so many consumers in the room as well. I think this is probably the best ratio we've ever had of consumers to researchers, so it really is a collaborative discussion that we're going to have this morning. So feel free to throw some questions in or challenge our panellists or Deb and myself as well to look at how we can do things better going forward. So as we have convinced you already, I know, that this is a good idea and CCI is something that we should all be doing, I think we'll try and make this discussion quite strategic and look at ways that we can improve the processes, include more people and bring more researchers into the fold and potentially more consumers as researchers. And I'd like to start with you, Kerry, on that point. So you obviously started your career as a researcher and then you became a consumer, and now you might call yourself a consumer researcher. What can we do in that space to engage with more consumers to actually become real members of research teams?
Look, I think that's a great question, and one that I thought about because since my diagnosis of myositis, then I'm also, unfortunately, I'm rocking up at ED more than I'd like to, and I'm going to outpatient clinics, and I'm sitting there in these clinics and going, there's nothing in here about being involved. Right, so I guess that'd be my first call in terms of the health system and the hospital services. Why aren't we letting people know? Why isn't there information everywhere about, hey, as a consumer, we want to listen to your experience? And I don't know the best way to do that, but But hopefully you will all have some ideas on that, because I think that's the first thing. And of course, as a researcher, it's always awareness first. Well, what do people even know?
Yeah.
If they know, what do they think about it? So before we can get them to change their behaviour, we have to actually start to raise the awareness. So I think an event like coming here yesterday, I'm like, well, hang on, there's all these empty seats. Where are all the young PhD students? Why aren't they all here? Right? It's like, and then if they are here, how are we getting them involved so that they understand to tell all their friends? I mean, like, this is one of the things when you get involved in something like the work that Dr. Walls was doing, and she's working closely with consumers and going, tell more people, tell more people. So I think that's part of it. First thing is raise awareness. How do we get the information out there that this is happening?
Okay, fantastic. So, Cath, you've been doing this for quite some time. You had a group, probably before anybody else in your field had a group that was involving themselves or was helping you with your research. Can you give us any examples of some innovative ways that you've actually included them in your research, some of the things that they've done that you maybe didn't think that they could potentially contribute to?
Yeah, so we have learnt a lot over the time.
Yeah.
Now all of the grants we submit, we would have a consumer research buddy who would be involved in all of the stages. So making sure it was a priority for the consumers, making sure that the methodology was suitable, particularly looking at, the different, if we're going to ask children and families, do questionnaires or do any forms of assessment, making sure that it's something that is acceptable to the people who we're collecting the data with. So very much they're now involved in part of the team, and you'll see most of the papers we publish in our team will have a consumer who has been involved and meets all authorship requirements because they have been involved from the very beginning, helped with the design of the study, they've read the manuscript, they've input it into the manuscript. So I think over the years we've learnt a lot and we have changed, I guess, our level of involvement from, us asking people to now completely co-design and working together to some final end products.
So with your new role at TKI, how do you, because TKI honestly has been a leader in this space for a long time, so how do you ensure that within TKI the opportunities are growing? Obviously your experience is invaluable, and I remember a couple of years ago Cath asked me to review an application that she put in, which I did, and then handed it back to her and said, you don't need my help, you're doing really well. So how do you give that information to the rest of the team at TKI and make sure that new opportunities are growing all the time? Yeah,
so I'm really lucky that our research team is at the Children's Hospital, and we're connected with Curtin University and also now the new Enable Institute, but also very lucky to have those connections at Telethon Kids. And I think it's really about collaboration, particularly also about modelling of how things can be done. And your comment about PhD students is really important. All of our PhD students have a consumer buddy. They also have to do the consumer training and are expected to, even before they do their candidacy, to come and talk about their ideas to our consumer group. And we had one PhD student who's now an amazing researcher in her own right, Claire Willis, who actually documented all of the changes that occurred in her project through engagement with consumers, and she's published a lovely paper, and 85% of her study changed with involvement of consumers, and the change has meant that her project has been really easily translatable into care for patients. So rather than this huge sort of 17-year lag, it's by the time she'd finished her PhD it was already implemented. So it was a very simple paper. She just took notes of everything she thought she was going to do and her plan that she came to with the consumer group, and then looked at the amount of change. And it was amazing, the amount of change, but the impact of that change on making sure that her work was translatable very easily to children and their families.
Yeah, right.
Cath, we had a question similarly, and if you can, I think you've probably already answered it, but or the panel, in terms of what advice do you have for researchers who have no experience or background in CCI? How do they get started? So you've mentioned a few things, but maybe just to clarify in answer to that question.
Yeah, I think training's really important. It's absolutely fundamental for everybody. I think everybody in your research team should be trained. I think
Look
having...
at our website.
Yeah, exactly. Having the opportunity for consumers to be trained and supported. Mentoring is absolutely fundamental. So if any of our PhD students particularly, or our postdocs are, presenting at our consumer group, they will be mentored either by a consumer or by another researcher before and after as part of the debrief. But I think the most important thing, it just needs to be part of the culture and the DNA. It's something that you are expected to do. It's not an optional extra. It's, part of your candidacy if you've got to do it. But I think training and education is really important. And yes, thank you for your website, all of that.
Well, and our CCI, our team is here to support and build, build experience and expertise with, with anyone and everyone, really.
Yeah. And you're a phone call away as well, which is great.
And can I add something in there? So, being a myositis patient, the myositis research group at Murdoch, they started a couple of years ago to actually run a research day for patients. So we all gather for the day, and Merrily Needham brings along her whole team, including PhD students, and they spend the day presenting to us patients about their research, and we have the opportunity to talk to them and engage with them. And it was an opportunity last year where we also, because they do this in conjunction with the Myositis Association of Australia, so this is the other thing, engaging with the patient bodies as well as individuals. And then from the point of view of the CCI program, we also had information there, and we found then that all these patients, we had all these, not all of them, unfortunately, but many of them decided to sign up and become consumers within the panel and put their hand up. And the beauty of that database then is you can see, who's interested in what areas. So I think that's another thing. As communication improves, and it's no longer of like, we need to keep them at arm's length. And it's brilliant to see these young PhD students who, it can be a bit daunting for them because we're a big room of like 80 odd people, but it just adds so much. And as a patient with a diagnosis that's currently untreatable, and IBM, for those of you that don't know, in terms of its outcome, it mimics motor neurone disease. It's just that your life's not shortened as much, as fast. So it's really empowering as patients with an untreatable disease to see what research is happening. So
cool.
So Pete, a blatant plug again for the Co-Roamers project, one of the best projects that I've ever been involved in, and one of the most comprehensive consumer and community involvement strategies I've seen implemented. How are we going to evaluate that, and how are we going to measure the impact?
Yes, we've had a few questions about that, comments about that as well, so it's good.
So not to put you on
no
the spot
pressure.
or anything.
Yeah,
This is a global question that hasn't been answered yet. I'd love to hear your point of view on that.
Yeah, on a stage in front of 80 people for the first time, great. Look, there are many answers to that. Evaluating the work itself, the outcome of the strategy, I guess there are a lot of ways to think about that. Our aim is for mental health research ultimately to get its fair share of funding.
The pie, yeah.
The funding pie, mental health. It's interesting because, as you know, we've met up with a whole range of different stakeholders, a whole range of different reference groups, lived experience and professional, and every one of them believe they're the poor cousin of other mental health areas. Anyone would think the whole of mental health was underfunded. I don't know. So one outcome, I guess, is whether we're successful in that respect. Does mental health get more of a voice in funding rounds? In terms of the process that we've gone through, the consultation and the constant feedback from people with lived experience, down to wording of materials through to the whole design, I guess one of the most important ways of evaluating that is the level of engagement we get. Do the strategies that we've implemented with the support of our lived experience reference group help people with lived experience feel confident that this project could have an impact, a genuine impact on their lives, and it's worth their time investment in it. So there are a lot of different strategies that we've implemented based on that feedback. The video that we produced and the wording that we've used, the terminology around mental health challenges as opposed to mental illness or mental disorders, for example. Does that help people with lived experience feel safe enough to get involved and that it is worthwhile? So they're just two ways of probably many that we're going to have to look at determining what worked and what didn't, how we can do it better moving forward. But certainly the research capacity and culture tool that we're developing will give us a lot of ideas about how to improve moving forward and that engagement. There's some really interesting ideas already spoken about today. Awareness is obviously really important, but already we've heard a lot about language that's used in research being really intimidating, people just not knowing what's available, what opportunities are available, and building that pipeline of people with lived experience over a long period of time, which TKI has done over a long period of time. And I think there's a lot of goodwill from researchers to get involved. They don't know how necessarily. They don't know what they don't know. So we need to certainly be building capacity and culture in people with lived experience to feel confidence to just throw their hat in the ring and give it a go and participate as fully as possible. But we also need to educate researchers about how to do it. I don't think it's a lack of goodwill. I think it's a lack of knowledge about how to do it well. And also the benefits and how rewarding it can be. You know, we're all so flat out and busy doing our day-to-day jobs. I think sometimes it feels like an additional thing that has to be done.
Yeah.
But if it's part of the culture and people get early experiences and mentoring experience how rewarding it can be. Yeah. Researchers want to have an impact. They want their work to have a positive outcome for the people who stand to benefit from it. Yeah. We just need to learn how to have the biggest impact we can.
Yeah, and on that, Jane and Dan, you can both probably contribute to this question. So Robin has asked about the perfect time to ask a patient to be involved in a study. So in a hospital setting, so Robin feels that the right time would be right at the beginning. So, but there are challenges with inviting somebody into a study who's potentially just been given a rather, terrible news, whether it's a diagnosis or whether it's a treatment option, which is quite nasty. So how do we engage with those people at the right time when we don't feel confident about the state that they're in at the time within a hospital setting? Jane, what would be your comments around that?
A really good question, because I think it is very difficult. I think it's always difficult to have conversations of all kinds with a person who's suddenly in that terrible space. I think one idea would be to make it something that's on the agenda for all the clinical conversations that are being had with a person. And also frame it in a positive way, so that it's about what good can maybe come out of this new situation that you're involved in. But I think it's probably part of the treating team, who could initially start, talking about those bigger opportunities for engagement and the different sorts of contribution that you might be able to make, which then implies a much better sort of set of communications between the treating team and the researchers who were, interested in that particular health condition, for example. So it really requires a whole new way of collaboration within the hospital setting. My experience, it's not the total experience, but there's certainly silos existing, and people are so incredibly busy and focused, and so it's a highly stressful context, hospital work at the moment, because public hospitals are so overstretched. So you're moving from one person to the other. You're focusing on that particular person and the treatment for them. These are the questions are much more sort of secondary, or certainly further down the track. But it would be nice to imagine a conversation whereby a clinical team could say, I'm aware of this person who's researching your condition. Can I have a chat to them on your behalf? And maybe sort of build those relationships. I think it has to be built up rather than just sort of saying, oh, here's a, would you like to be part of this? Here's a consent form to sign. So it has to be a conversation, I think. And I think, we talked already about communication. We've talked about the importance of showing how your contribution actually matters, that what you can do as a consumer is going to be ultimately important, and those conversations are really generating the sort of interest and the sense of possibility, I think.
So Dan, with your, obviously one of your soapboxes is consent, but around that, so we're talking more...
Before we get to that, can I add to the previous question?
Please.
I think what needs to happen is we need to create a culture of expectation so that when patients are interacting with health professionals, they're all automatically aware and expect to be asked about the opportunity to participate in research. Because the current situation is it's just going to come cold out of the blue, because my impression is that the general level of community knowledge about research processes and about participating in research is actually, we're starting from a pretty low base.
Yeah.
So I'm hoping that an organisation like CCI can raise the level of knowledge in the community about research, the benefits of research processes, such that we get to the point that when somebody arrives in those situations, they're not surprised by the request to consider participating in research. So it's creating a culture of expectation. So recently I was a patient and I got enrolled in some research. Helen, our research nurse, enrolled me in one of our own studies. But I was annoyed. I was also a patient a couple of days earlier, and I was a bit annoyed because I didn't get enrolled in any studies for that attendance. But I'm a bit nerdy and biased.
I was going to say, do you think it's a general rule for most people?
But really, we need to raise the level of knowledge in the community about research and create that culture of expectation.
Yeah. So thank you for putting it back onto us to do it.
Yeah, I was going to say, I see what you're doing, Daniel Fatovich. I see what you're doing.
Yeah, Kerry?
That's really interesting, Dan, but then I guess what I would like to see is that, okay, if you're not enrolled in research, at least someone's saying, but look, here's the CCI program. So if you join this membership database, you'll get information about research as it comes up. Because I think there's another aspect as a patient. You don't always want to be involved in terms of community involvement and engagement, in something to do with your own disease. So I was asked, I don't know how many times, would I join the myositis research panel, which is a national panel, and I just said no, because I didn't want my diagnosis to rule my life. Now, years down the track, I've just recently joined. But I think that, I'm putting it back onto you now, that within the hospital setting, if there's a case of making sure people are aware that the CCI program's there for them as a patient to link into. And can I add one more thing too? From a patient point of view, now that we live in the world of social media, of course I'm going to go out and look at patient organisations related to my disease. So that would be another area where it could be useful for clinicians to be telling patients as well. There are these organisations too, so that, and hopefully then those organisations will share information about CCI.
So we had a comment about when's the right time to ask patients to be involved in research, but we've also had a follow-up question, when's the right time for consumers? So anybody in the community to be involved in research, when's the right time for that to happen? I would say any time, but but absolutely. When is it a good time?
And if I go back to my advertising research days, they've got to hear it 7 times that it's there before they're going to take action. So it's everybody's job to be spreading it.
And on that as well, so we had a couple of questions fed through even before this morning. Some people wanted to talk about how do we reach those hard-to-reach groups? So how do we get to the called populations? How do we get to the Aboriginal communities? And funding bodies nowadays are demanding that work is done before they actually fund any piece of work. But we all know that it takes a lot of time to be able to build those relationships, gain the trust and the willingness for people to actually engage. Pete, how have you found that with all the different reference groups that you've been working with over the recent times?
Yeah, look, we've all had that experience where we kind of we're working on a grant and we genuinely want to engage with consumers who have had the right experience for a project, and the deadlines kind of approaching, and we're finding it really hard to find the right person at the right time. So, I think having as I said before, a pipeline, or regular engagement of a core group of consumers that you can continue to mentor and establish those long-term relationships with, I think will help a lot of researchers, and Enable Institute again is going to be set up that way so that researchers, when they need a consumer perspective, those relationships are already there and that experience is already there. So that's going to be really important. With the Co-Romas project, we set up the consumer group at the very beginning and have met with them regularly to provide that guidance and that support. And they're super keen. They're always available to us to share their input. With the Co-Romas project more broadly, we've tried to engage with a range of different consumer groups across a range of different areas that no single person can be across. So we've really relied very heavily on our networks and networks of networks to be spreading the word and inviting their networks. So Jaya helped us a lot with the cold reference groups, and there have been other people, Bernadette Wright and others, who have really championed the project, and then we've been fortunate to be able to borrow their expertise and their support. So it's all about those relationships, I think, relying heavily on our networks and really working hard to find the right people to support it, both professional and people with lived experience. But that takes time, and we really need to keep that pipeline of expertise and experience.
Can I just pick up on that? Because I think it's part of the problem. General population feel that they really don't have a stake in what happens in the health system, and I think it's a systemic thing. And I think probably more engagement of consumers in health issues and having a voice in health making decisions, health decision making. I think that could lead to more engagement in research, because it's part of the same thing. We all want the same. We all want better health for the community, and the more I think people can become involved in one aspect of it, the more likely they are to become involved in another. So looking at those connections and bringing in people who are already, for example, like myself, I was already in a hospital consumer group, and becoming part of a research consumer group was a natural progression, really. So I think how those different aspects of health can overlap and inform one another.
And on that, we've had a few comments, but I can absolutely clarify. Brennan Friend is in the room up the back there. So the Health Consumers Council WA and CCIProgram are continuing to work together in collaboration, but with more and more in terms of there's a long-term future plan for us to be working together. So it is, as you say, Jane, bringing together that element of involvement in research and health service and engagement in health services as well. So I can't find another word for it, but it's a marriage of not just of convenience but of common sense. And a huge overlap between those two organisations. So that's something, again, to be able to see that we're trying to do. We've probably got time for...
Ben, can I just add? I think
Please, Cath.
funding is a really important thing when
Yeah,
we're looking at particularly engaging diverse groups. We need funding for translators,
Yep.
And we need that funding before we even put grants in so that we can actually have those really important conversations. We also need funding if we want to go and get the voice of our rural and remote communities, and often that might be a visit. So I think it's really important that we address the issue of funding. So as a research, once you have a grant, you can involve consumers in your research because you have a budget line and funding for that. But the gap is before you put your grant in, and that's the most important time to involve consumers and community. So I think funding is a really important issue.
Yep.
And, you know, it's very hard to get funding for interpreters at the, you know, very beginning of your grant, or to do that community connection. Sorry.
Yeah.
No, and it was a question that has been asked in terms of is CCI being resourced as it should be, you know, because it is. It's not just about once you've got your research grant moving forward. It's all of the stuff which you've all talked about in terms of the beforehand to make sure that the questions that are being asked are the right questions and that they're being asked in the right way as well. So
So we all know, as we've identified, that this is a good idea. We all know and value the fact that consumers need to be compensated for their time, just as everybody else working on a research project is. We all know that consumers are indeed invaluable before we've even decided upon the research question that we want to investigate. But the big gap in all of that is that there is no funding available to be able to support those consumers to have those conversations with hospitals or with universities or with research institutes. So that, I think, would be a great opportunity for somebody to come up with an idea, whether it's WHTN or whether it's the state government or whether it's the institutions themselves. But there needs to be a strong commitment to resource CCI across the board to make sure that it is available at a strategic level to inform everything that's going on underneath. That's my soapbox for the day.
I like that soapbox, if anyone was wondering. There's probably 2 sets of 60 seconds left. If any of you, this is an opportunity, if you want to take the opportunity, if one of you was in a lift with Minister Roger Cook and the person from Treasury who signs the checks, what would be your elevator pitch? 60 seconds. You know the doors. You don't get to push, hold, and stop the lift.
Cath, I think you actually had one written for you, didn't you?
Yeah, I've cheated. I actually asked one of our consumers.
So give us your elevator pitch, because we all need to have that ready, just in case we are in a lift with Roger Cook and the person from Treasury who signs. We'd all love to meet that person, that's for sure, who signs the checks.
So I asked one of the mothers that we work with who has a child with cerebral palsy what she would say. So I'm going to read this word for word because I thought it was beautiful what she said. We need support for families who have children with cerebral palsy and people with cerebral palsy to be involved in research as they are the experts about living with cerebral palsy. We can tell you what is most important, as well as helping you design research so people with cerebral palsy and their families want to be involved. This is the best use of research funding, as research is done that will make a difference in a way that is most acceptable to children and families.
And the elevator doors haven't even opened. I love that. That's fantastic. Anybody else on the panel want to take the plunge? Last chance.
Yeah, go ahead.
I don't want to really take the plunge because I think Ben did it before. That would be my pitch.
Okay.
Yep.
Sorry, I stole you.
Look, he doesn't need puffing up anymore. Just, that's good. We'll endorse that, Peter.
Yeah.
As a psychologist, I really like Socratic questioning.
Yep.
So I would be trying to turn it on the Minister to
I
argue
like that.
against.
Good, yes.
So, Minister Cook, I just wanted to ask you a few questions about why CCI is not important in healthcare, health service research. Why shouldn't we ask people experiencing mental health challenges what would help them to flourish? How can we be sure what they need without asking them? If we haven't experienced a particular mental health challenge ourselves, how can we possibly know that our research is asking questions that, if answered, will have the biggest impact on their mental health? How can we know how to ensure the system is more equitable, accessible and effective if we don't hear from the people for whom it has been inequitable, inaccessible and ineffective? Without these insights, how can you be sure every dollar is being spent wisely? What are we afraid of? I don't know how much more time I've got.
I'm loving
but
this. We're probably nearly getting to the doors are nearly opening, but yeah.
So in the last 5 seconds, I'd say, so how can we make this happen?
I love it. And sign here, check, sign here. That's great. Okay, so yeah, Peter McEvoy for the next, you just chase down. Can you ride a bike? Chase down Roger Cook. I don't know, whatever we do.
Can I do one sentence?
Absolutely.
Our research focuses on patient-oriented outcomes, so we need the patient voice, the consumer voice, in a structured and funded fashion to help us inform the best research.
I love this. And we're recording this session, so it's even better. So those words might hopefully not come back to haunt you, but I'm really keen to be able to utilise those. Yes, last, and then we've got to finish.
Sorry, it's like, I think we also need a health economics statement in there. So if we have one example, we can go, and because of this, X dollars were saved from the hospital
your value.
system.
Yeah. This is your return on investment. Yeah, no, absolutely. We've the phone has gone into meltdown, which is fantastic, with questions, lots of suggestions as well. I think we've talked about raising awareness. We've talked about working with a network that's already there, utilising our research foundations to be sharing amongst a health system, using and educating and training people, whether or not it's in the research sector, community schools, universities across the board. So lots of challenges, and I don't think I dodged all of those in terms of CCI program. We love what we do, I've got to say. I would just like to be able to say thank you to all of you for being willing to come along and sitting in the hot seat per se, but your experience and sharing helps the conversation. I know everybody in this room, if you haven't already, is either doing it and involved in some way, regardless of who you are and what you do. And if you aren't, then maybe this will continue to spur you on. What's next? I just want to be able to say thank you formally. Look, I have gifts. And I didn't pay for them, so that I don't have money, but I wish I had money. Thank you so much for all of you. Can we just say thank you to the panellists? Thanks, Cath. Thanks, Kerry. And also, I suppose my challenge to all of you is to say, well, what are you going to do now as a result of having breakfast in a room with amazing people and hearing amazing people? So that's the challenge I want to put out to you. I'd love to see next year's Science on the Swan have even more in terms of CCI and that becoming much more visible. Please go to our website, get in touch with us. CCI program is here to support people regardless of where you are. We do training, we've got lots of resources. You saw the video this morning, and there are, as I said, there are a few more of those on our website. Use those, get in touch with us. But yeah, I just want to say thank you very much. Thank you for sharing your time, for getting up early, and it's about time. Oh, look at that, 8:50. Yes, to be able to get a coffee or do what else, and then make your way into the plenary session for Science on the Swan. Thank you so much for being here. Thanks, panel. Fantastic.
Revenge is awakened.